Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Welcome back. This is going to be part 2 of our conversation with Wayne Orchard from Lyric Health. If you missed the first episode, please go back and look at it. We're taking a deep dive into telemedicine and virtual healthcare. And the first episode was very informative, and we're going to keep on going talking to Wayne today. Of course, when you're teaching, when you're talking to somebody about embracing this, what we call next generation services, they're trying to put all the pieces of the puzzle together, and they get the part about getting on the telephone and talking to the doctor. But when the doctor says, I need you to go out and get a lab test or a stress test, or I need you to go see a cardiologist, they're kind of like, oh gosh, now what do I do? And talk about where your care team comes in. And let me say, before you respond, let me say that I have watched over the years, I've watched your care team evolve from basically customer service team that helps people enroll and use your software systems and get appointments and stuff like that, to people who are required to have a certain amount of medical experience or medical education. And they are medical professionals in their own right at their own level. So they meet a much higher standard. And that's, I've watched that evolution. And I understand you have to do that to keep up with what you have described in providing level of service and follow-up. But back to what I was asking in the first place, when that doctor says, I need you to go out and see somebody else, how does your team step in and support that? Talk to me a little bit about MDsave and how you use that as a tool to help people stay on an affordable cash basis.
Yeah. It's all about, getting over the hurdles of what normally stops people from getting healthcare. One is the process, right? The other is money, the unknown, when I go in to get a prescription that a doctor called in, do I know how much that is? I'm right. Going in, get an MRI, it's again, so unknowns we don't like. And so we're not going to, as a consumer, pursue those. So the purpose of the care team is to be the caregiver, and I typically always say, okay, you're now the wife of the patient, even if it's going to be a woman, a patient, because like my wife, is the caregiver of the house, and she is the one who always, Wayne, you got to do this. We got to do this. Don't forget to get your medication.
She keeps the list. Yeah.
Right. But, I'm a grown man. I should be able to do that. But sometimes you need that nudge, right? You need the reminder and stuff, and the accountability. If I'm not, if I get the prescription for labs, it's called a requisite, right, to go get a lab. If I'm really not accountable of getting it done, if I don't have to turn in the homework, do I really need to do it? The care team steps in and make sure that the onus isn't just on the consumer. They take full responsibility. They are dedicated care teams to the doctors, to those patients, right? They step up and make sure that it gets done. But not only that, is how do we make sure that money's not the issue? right? That there's no surprises in this. So if it's helping set an appointment or like MDsave, one of the largest imaging networks out there, you know, uh, my daughter needed a MRI on her foot, and the doctor said, "Here, and you get an MRI." And again, if it was just up to me, I would have Googled MRI and, okay, is this covered by my insurance or not? And it would have been out probably a couple $1,000s. Well, care team gets involved and says, okay, here's the order. Let's see, Wayne, what's your insurance? What's kind of coverage? Oh, hey, have you ever heard of this, resource called MDsave that we can go on? And the MRI, that's going to be $450 with contrast. What? And the only difference is that you have to pay, at the time of service or, ahead of time. And then if you want to take that and apply it to your insurance, to your deductible and all that, you just have to do a little bit of work. But the MDsave is one of the resources that the care team is engaged in making sure that cost doesn't become an issue. It's the same thing with the labs. We have contracted directly with like LabCorp and Quest Diagnostic to get the lowest pricing that they can and make absolutely no money on it. We pay the administrative charge, on it. And that's it. Because a lab that, like the lab panel, that, we have, that's free, that comes with our virtual primary care, right? Again, we put it as free because we don't want costs to be an issue there. So the care team, yes, not only is knowledgeable on the medical side, but they're very knowledgeable on the consumer side and getting what is best for the patient.
Well, the cool thing I like about MDsave, and for those of our viewers who are not familiar with it, it's kind of like GoodRx, except instead of accessing affordable prescription drugs, you're accessing cost-effective, affordable medical services from your primary care, whatever, specialist and labs, testing, things like that. It's a source to identify that stuff. And what I like about it, besides being able to find more cost-effective services, is that when you do go through your care team at Lyric and arrange for those, make those appointments, arrange for those services, it all goes into your electronic medical record. So your doctor, your urgent care, your virtual care doctor, all have that all codified in records. Moving on, I have a history. For those of you who've watched the podcast before, I have a history in the automobile industry. I started out with various automobile manufacturers, Chrysler and Nissan Motor Corporation, and so I was there on the front line when a company named J.D. Power came into existence. And J.D. Power, with so much bad history in the automobile industry, dealership jerking people around, mistreating them, they came on the scene to survey and identify the best dealerships out there, the ones that treated their customers properly, really took good care of them, great customer service. And they became the gold standard of that. But now they have expanded out to a lot of other industries, and they're in a totally different league than getting the Inc. magazine top 500 awards, which I know Lyric has got plenty of those recognition from Entrepreneur magazine or Inc. magazine publications like that. But J.D. Power is like they're like the Academy Award in the entertainment industry. And I know that Lyric has received several awards, recognitions over the last couple of years from J.D. Power. Could you tell me what it takes to maintain a staff that performs at such a high level to reach that achievement?
Yeah. So, JD Power is all about customer satisfaction,
Right.
quality of service. And they have a division called Telemedicine Customer Satisfaction. And so for the last 4 years, we've been, in the top 5, usually within the top 3 or 4. For 2024, we were notified in October when the news comes out that we are ranked number 1 for telehealth customer satisfaction out of all, especially now with virtual care companies across, you Google and you have 2,000, out there to choose from. And so service is one of our cornerstones that makes us different in the way that we're going to treat not only our customers, but our clients, our doctors, our employees, each other. And so getting it from JD Power, as you said, is unique because Inc. magazine, Entrepreneur magazine, those are things that you apply for, right? You gotta show your mustard, right? You gotta, hey, I'm gonna put my resume together and put it out there, and I'm in the top 500 or something like that.
You
JD
might
Power,
even,
you have
might
no
even
say
have to buy some advertising or something, right?
Some, right?
Yeah.
I've got, because a lot of times you can be self-proclaimed number
Sure.
one or something. I have a shirt that says number 1 husband on it, and I just, I voted on it, and I said yes, right? JD Power, you have no say so in it. We don't know how they even go about judging this, right?
Mhm.
And as I have told our employees, that it's because we do what we need to do. We do what's right. There's, many instances, regardless of eligibility, if someone needs help, we're going to help them, right? We're going to be there for them 24/7, 365. But one is that I care about our care team, our employees, and therefore I want them to care for our members, right? So it has to kind of really be ingrained. People could talk a good talk, from corporations about how service is, priority number 1. But if you're not showing it and being consistent with it, then you're not going to get those types of accolades. And again, we don't do it to get an award, right? We do it because it's the right thing to do. And there's too many things in America right now that aren't right. Corporations that aren't doing, things that are right. And so we want to stand out. And whether that is our employees, our clients, our affiliate resellers, to our members, we want to make sure that when someone walks away from an interaction, that, they have a pleasing factor to them because of it.
Well, my business philosophy has always been that your employees come first. You take good care of your employees, and they'll take good care of your customers, and that's good for everybody. I have had the opportunity on more than one occasion to walk through your office, and you can just sense there's a different culture. It's an open space scenario. It feels like everybody's a family, and it just made me feel good about, aligning my company with yours and doing business with you. I've watched the virtual healthcare industry over the last few years just explode with growth, just exponential growth. I know you've gone from, I think, hundreds of thousands of members when I first aligned my company with yours, and now you've got millions. I don't know if you want to say how many millions, but I have an idea. But you're certainly one of the most successful companies out there. What what's coming in the future? What's on the calendar for future development? I think the latest thing you came out with was your weight loss program, but what else is coming? And you might talk about the weight loss program along with us, since we haven't touched on that yet.
Yeah. And it's always about bringing more services, and you're right. In 2015, when we started, was zero, right? We had to start somewhere, had to start with one. And after, ones are always the, renewal dates and new, groups coming aboard. So we'll be over 6 million members in 2025. So, not too shabby for the 9 years that we've been rolling here.
That's fantastic. Yeah.
But it's always, okay, how do we improve our services? How do we bring more services when we went from urgent care to primary care, added dermatology in there, went from telephonic counseling to adding virtual psychology and psychiatry, right? We put our vet program, our pet care, virtual pet care.
I was going to say, you've even got a pet care program. Go Lexi.
Yep. Put together, right? Mm-hmm. Which is exclusive through our affiliates, right? Mm-hmm. It's not something that someone can just go out, because again, it was an expansion of our services for our members. Things like musculoskeletal, therapy that usually is in physical locations, and a lot of it is stretching and doing exercises that you don't need these big machines. It's okay, I need you to do these bends. All right, can you do this? All that can now be done on a virtual basis, right? There's things like dental and vision that are being proven more and more, right, throughout the years. And we had vision and dental on the virtual care side, kind of in the wings, and there's been some huge improvements there that will be something that in the next year or so that we'll be having there. Our latest
is that a discount? Is that a discount service product, or is it actually a virtual product?
No, it's an actual virtual product.
Okay.
They got technology now that if you have a prescription, maybe it's running out or just ran out, for eyeglasses or contacts, with even just your phone, but laptop or tablet's even better, you could do an at-home test, right? There's two different tests. There's one of, do I even need vision correction, right? And then there's, I need a new prescription, right? So, every year, I have to order a new yearly worth of contacts, right? And I could go through this process and never leave my house to do it, and I've got through like 800 contacts, and so, you can order, through using Google online. So things medically that has always been, well, I need to go out and do this. And because of the process where we continue to push off, well, we can now take care of instantaneously, right? One of those, and that's being launched right now. We've been in beta, for quite a bit, because we want to make sure to get it right, is our semaglutide weight loss program. So Ozempic, Wegovy, those that have come out from a diabetes management to a weight loss management tool, they've had supply chains issues and so on. And a lot is because of the way that the pins and stuff that, they have to fill them at the cartridges and get them out. But this is all semaglutide. That's the main ingredient in this. This is what makes it all work, right? So, the FDA allows a compounding pharmacy, right? So this is not CVS or Walgreens or something, right? This is a mail order pharmacy to compound the formula for the same thing that you would be going and getting, from Ozempic, right? But doing it on a virtual care side, we're able to contain costs much, much better because our doctors are, we have our clinical guidelines that you have to be approved first, right? This isn't for cosmetic. This isn't, oh, I need to lose 15 pounds, right? No, you need to go to the gym or something, right? You have to have a certain BMI in order to qualify saying you need to be on this medication, right? If it's not that BMI, do you have a certain BMI with 2 chronic, conditions and stuff? So there's clinical guidelines that we follow, again, with our board certified doctors overseeing patient, consulting with them. This isn't pop through the screen, yes, no, input, and I got a prescription. All right, we're not a prescription mill. We're doing this as a process, making sure that someone is clinically appropriate to be doing this, right? Has the mindset in order to do this. And then, of course, we have a lab that needs to be done, right? Because we want to check to see, hey, is there anything else there that we need to be worried about? Is there something, is there liver function? There's things that somebody, you need to know when you're taking these types of medications. Then you have, of course, starting from day one, you have the care team that's going and helping walk the person through the process. Then to make sure that the person gets the medication, we electronically send that off to the mail order pharmacy. Mail order pharmacy sends it directly to someone's house, overnight shipping. And then the care team is following up, right? Making sure, okay, any side effects? And we know, we're not hiding from that. There are side effects. And we tell people going into it, you have more than an 80% chance you may be nauseous, right? If so, guess what? We can take care of that in one phone call and maybe, medication for nausea, so we're able to care for them. So someone doesn't just stop the program because of it. If it's, excessive, then now you take, next steps on it. But to get, through that, then now you have to be consistent and have every 30 days. This isn't a 6-month supply. We do a tiered program that we start on a light dose and work our way up into possibly a maximum dosage. So that way your body is getting used to that. So we're doing all this in a virtual basis that cuts our costs way down. And so Ozempic, on average, just the drug, we're not talking about the doctor visits and the labs and everything else, is about $1,000 a month to take a shot. You get 4 once a week, right? So you get 4 through the month. So it's $1,000. And typically your insurance isn't covering that because they don't believe obesity is a disease state yet, right? Well, hey, yeah. So, okay, fine, insurance company. Again, healthcare, the carriers, they don't care. They're in the claims business. Well, we want to make sure that someone is getting proper care and getting at a reduced cost. So we built a program for $249 a month. Covers everything. Your doctors, your labs, your care team, even your nutrition and fitness guidance, right? Because medication alone doesn't get you maximal results. That's what people want. They want maximal results. Are you going to get results just off of that? Yeah. But hey, how about if we put a good nutrition and fitness, within here's, guidelines to do it, and then the medication coming to your front door, every 30 days, like clockwork, because you're also doing your monthly consults. And if there's anything that needs to be tweaked, right? We need to slow down the stair step or whatever. We can, it isn't just, you're not calling in and talking to the assistant, or nurse or something. You're having a doctor, follow your path throughout this whole process. So, so Lyric Lean, that is going through, companies like yours, Larry, for consumers, is going to be a huge step in fighting obesity that leads to a lot of catastrophic claims later on. So, it's kind of, when we look at pay now, pay later, let's go ahead and just get things, under control. It's just like with your annual wellness exam. Hey, if you have high blood pressure, hey, if you have high cholesterol, okay, we're gonna meet the consumer where they're at, and let's get a treatment plan. If we want to do maximum results of, right, we want to get off of these medications and stuff. Well, what does that take? And that's what we're going to help them do.
Yeah. One franchise I invested in the past was nutritional health weight loss franchise. So I really got deep into that. I have a deep understanding of how challenging that is. So I'm looking forward to learning more about this. I know these Ozempic and the related type drugs are a hot item right now. A lot of conversation in social media about it, but it seems to offer some promise. Let me clarify something for the benefit of our viewers, listeners. Relative to the lyric urgent care versus virtual primary care, having your own dedicated doctor, the urgent care doctor cannot write prescriptions other than just simple stuff, non-DEA regulated prescriptions. They can also refill existing prescriptions for you. Your dedicated doctor has a little more latitude to address a broader range of prescription needs because they can do the lab tests, et cetera. I just want to make that clear.
Yeah. And the acute and the urgent care, right, is again, you're not selecting a doctor. It's 2 a.m.
Yeah.
I'm sick.
Yeah.
I need a doctor, right? So we've got automatic rotation and stuff is next doctor up, that's typically calling someone back within 15 minutes, on a national average. So it's pretty immediate care, but it's for that one particular thing, right? And like you're saying, then it's now acute illness prescriptions, the antibiotics and stuff, where on the primary care, now you're building that doctor-patient relationship in order to get and maintain those long-lasting, disease states that someone may be in, and how to, not, cure it, but to at least get it under control.
Right.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.